Hi everyone, my name is Dr. Pamela Muga, an obstetrician gynecologist working in partnership with Ponea Health, and we are going to discuss high-risk pregnancy and a little bit about low-risk pregnancy. So low-risk pregnancy happens when you have no problems at all, you get pregnant normally, and your pregnancy continues as normal, as expected. But high-risk pregnancy is something that occurs either before pregnancy, so that you have a certain condition that makes your pregnancy high risk, or it can happen after pregnancy. So you get pregnant, and then we discover that you have a certain medical condition that makes you high risk. High-risk pregnancy just means that we need to see you a little bit more often, and we are a little bit more concerned about the progress of your pregnancy. So anybody who gets into pregnancy with a pre-existing medical condition, so if you have diabetes, if you have asthma, if you have cardiac disease, or anything else that you're on medication for regularly, it's always important to see us regularly during your clinics so that we can establish. The reason is some of these medical conditions can expose you or predispose you to certain risks that occur in pregnancy or during delivery. And if we discover them early, then we are able to plan appropriately, either to prevent those risks from occurring or to mitigate those risks when they do occur. So we are able to handle any problems that occur in your pregnancy appropriately. High-risk pregnancy that occurs during pregnancy would be problems that are related to the pregnancy. So there are certain people who get elevated blood pressures or high blood pressures during pregnancy, and that's one of the issues that makes your pregnancy a high-risk pregnancy. So it's always important to go for your antenatal checkups, and during your antenatal checkups, then they do your vital signs, and that's where we check your blood pressure. We're able to tell that it's high, and we're able to follow you up. Once your blood pressure is high, then we normally check your urine and check about swelling of the body. So it's important to do those, and it tells us if you have that elevated blood pressure that's caused in pregnancy. And that's the beginning of a disease that we call preeclampsia, which we'll discuss in another episode. Some people also develop elevated blood sugars during pregnancy. The placenta creates certain hormones that start to affect the way your body metabolizes sugar, and that can cause your blood sugar to go up. So it's always important to attend your antenatal clinics, and there are various checks that we do to determine whether you'll develop that. Also, for first-time mothers, it's always important. One of the reasons of first-time mothers being semi-high risk is because we don't know your story. This is the first time that you're carrying that baby, so it's always important for us to follow you through and see if there are any risks that would arise during that pregnancy. And it makes it much easier for your future pregnancies, because then we'll have your story and we'll know how your pregnancies generally proceed. That being said, every pregnancy is different, so it doesn't mean that if you're not a first-time mother, that you're not at risk of getting a high-risk pregnancy. Also, for patients who have extremes of age, and extremes of age means either you're very young or you're a little bit older. In terms of obstetrics and gynecology, anybody above 35 is considered a little bit older, and those below 25, below 20 years old are considered young. So any teenagers who get pregnant, it's always important to attend your antenatal clinic, and for those who are over 35. These extremes of age predispose you to certain risks that may not necessarily occur in the other age groups. So it's important to attend your antenatal clinics and be able to follow up your pregnancy appropriately. Also, for those patients who are carrying more than one baby, it's always important to attend your antenatal clinic. More than one baby is usually a great source of joy. However, because of the placenta and the fact that it's producing certain hormones, for patients who have more than one baby, your placenta tends to be bigger. And so those hormones are more, and they affect your body more. And so it's always good for us to see you more frequently, and that makes you a high-risk pregnancy. Thank you for engaging with me in this episode. You can book our services at ponea.com. We look forward to meeting you in the next episode.